What pops in your mind when you hear the word cancer? You might imagine a horrible condition with an agonizing end, or the way Big Pharma tries to benefit from people. But is it actually so? Let's find out. Cancer is a term used to refer to a group of diseases caused by uncontrollable growth of abnormal cells in parts of the body, such as lungs, skin, and colon. Such abnormalities is the result of the mutation of cell divisions controlling gene, which leads to uncomfortable divisions of mitosis, and furthermore, those abnormal cells don't undergo apoptosis, a natural method by which cells kill themselves when they are old enough, causing an exponential increase in the number of those cells, which in most cases causes tumors. However, those tumors aren't classified as cancerous until and unless their cells have the ability to spread to other body organs and develop there. Otherwise, those tumors are benign and doesn't impose any threat on the body. We can agree that cancer is less lethal and easily treatable in the earlier stages than late stages. But this doesn't mean that all patients are doomed. An article published by Cancer Research UK stated that more than 9 out of 10 bowel cancer patients will survive the disease for more than 5 years if diagnosed at the earliest stage. Furthermore, around 70% of lung cancer patients will survive for at least a year if diagnosed at the earliest stage, compared to around 14% for people diagnosed with the most advanced stage of the disease. One of the factors that increase the chances of survival is an early diagnosis, but improving survival rates is not just down to earlier diagnosis, but ensuring patients receive the most effective and appropriate treatment for them is also an important part. It's also worth mentioning here that cancer can come back at any time. Yes, you heard that right. Chemotherapy and radiotherapy are just treatments. Because cancer has the ability to reoccur even after years have passed since the last trace of cancerous cells in the body was found, amongst the various cancer treatments, sometimes surgery might be the most suitable one. But wait, doesn't surgery cause cancer to spread? Well, no. This misconception is believed by patients because they experience fatigue after surgery. However, it is totally normal to feel that way after any type of operation. With current technological advancements, the chances of such incidents are significantly low. Following proper surgical procedures, such as not using the same tools to remove a tissue from different parts of the body, will prevent cancer from spreading. Some people even believe that getting tumors exposed to air causes cancer to spread like wildfire. The latest research shows no proof of such claims. Furthermore, cancer has the ability to spread throughout the body without any surgical interventions. Such processes involve those pesky cells growing and reaching the lymph vessels, empty to the blood. As the blood moves, cancerous cells get a tour around the body, ending somewhere in a totally distant organ. From that point, cancerous cells divide again and form new tumors. Hair loss is the most common effect attributed to cancer, but contrary to common belief, cancer doesn't cause hair loss. Hair loss is rather an upshot of chemotherapy and radiotherapy. Chemotherapy treatments involve chemicals that kill fast-growing cells like cancerous cells. For example, cisplatin, a chemical commonly used to treat specific types of tumors, interferes with DNA strands. This in turn causes DNA damage, an improper repair of DNA by the cell forcing it to undergo apoptosis. Sadly, the downfall of this treatment is that it can also affect some of the fast-growing healthy cells, like those of skin and hair. As hair growth takes place in the cells of the hair follicles. Healthy hair follicle cells divide every 1 to 3 days in a cyclical pattern of growth and rest. The treatment does not differentiate the healthy cells from the cancerous cells and eventually cause hair loss. Radiotherapy also causes the death of cancerous cells as well as healthy cells by utilizing ionizing radiation from radioactive materials. However, in radiotherapy, hair will not fall out in the area of the body being treated. For example, if you're having radiotherapy to your head, you'll probably experience some hair loss from your scalp. The good news is, hair grows back once cancer treatments are over. Cancer is a scary condition indeed. That doesn't mean a cancer patient can't live his or her life to the fullest. However, some people might be reluctant to be in contact with cancer patients due to the fear that cancer might be transmitted to them, but no worries. Cancer cannot be transmitted by physical contact. The only situation in which cancer can spread from one person to another is in the case of organ or tissue transplantation from a party that has cancer. The fact that makes this possible is that the patient takes a set of medicines which weakens the immune system, which is done to ensure successful transplant of the organ, without the body attempting to destroy the organ. Luckily, such incidents occur in rare cases, and organ donors are carefully screened to reduce the risks. With that said, although cancer cannot be transmitted, certain viruses and bacteria, which are transmittable, can cause the development of cancer. Those pathogens include hepatitis B virus, HBV, a type of virus that can infect the liver and cause hepatitis B when transmitted through blood contact, and Helicobacter pylori, or H. pylori for short, bacteria that infects the stomach when transmitted through water or food contamination and is responsible for ulcers. Nevertheless, there are no reasons to be scared from such infections. Proper hygiene and habits will ultimately reduce the chance of these infections. Sugar, the chemical that makes our foods and drinks sweet. Our body relies on sugar, as well as other carbohydrates, to provide energy for metabolic activities like muscle contraction, growth, and even repair. Studies have shown that cancer cells consume more sugar than normal body cells. This led people to believe that consuming more sugar can cause cancer, such that sugar-free diets will kill cancer cells and cure people from this hideous disease. Nevertheless, there are no studies that support such claims. Even a sugar-free diet will still supply sugars to the body by the process of deamination, in which excess amino acids, the digestion products of proteins, are converted to glucose and urea in the liver. In other words, every carbohydrate ends up as glucose in the blood. So yeah, you can enjoy your banana split if you're watching this video. However, take care, since excess sugar consumption can cause obesity and diabetes, which have been linked to an increased chance of forming cancer. When medicine seems not to work, people often try certain diets that claim to cure them of cancer. So far, no diet or herb has proven to be capable of curing cancer. A good diet can aid you in maintaining an ideal health, strengthens the immune system, and in turn, protects you from cancer in the first place. But if you have cancer, then a diet or herbal mix surely won't cure it. In fact, it can do otherwise, since some herbal components can intervene with chemotherapy. Due to the treatment cancer patients go through, one must fulfill his or her daily nutrition requirement in order to avoid possible malnutrition and further weakness of the body. If you still believe that natural ingredients cure everything, remember that before technological and medical advancements, the average life expectancy was about 40 years, pretty much lower than today's standards. We hope that you've enjoyed our video. Make sure to share it to your friends and family and let awareness prevail ignorance. If you're looking forward to more videos by us, please consider subscribing and liking this video. Each and any support is greatly appreciated.